What's the deal with aloe vera? Does it really do anything? Well, you know, aloe vera gel and aloe vera juice have been used therapeutically to treat a number of conditions. Particularly useful with peptic ulcers or stomach ulcers and some other intestinal problems. We'll talk about that, including it's a natural laxative as well. But you can be applied topically as well to the skin to treat the healing of burns and also other wounds and some other skin conditions. Now, let's talk about the intestinal use, because it's useful for stomach and some digestive conditions, particularly peptic ulcers or duodenal ulcers, stomach ulcers, and also stomach inflammation known as gastritis. So how does it work? Well, one way is that aloe vera gel has been shown to inactivate pepsin release when the stomach is empty. So people that have ulcers and gastritis, they often secrete too much pepsin between meals. But the aloe vera gel also inhibits the release of hydrochloric acid by interfering with the binding of histamine to the parietal cells. So normally the parietal cells in the stomach secrete hydrochloric acid when they're stimulated by histamine. Where does the histamine come from? Histamine comes from the enterochromaffin cells in the stomach. So when histamine binds to the parietal cells, it causes hydrochloric acid release. If you can block the binding of histamine to those parietal cells, you can decrease the amount of hydrochloric acid that gets secreted. That's helpful in treating ulcers and gastritis. So clinical studies show that it helps in the healing of peptic ulcers. And it can be used alongside of other ulcer drugs. So normally if you have ulcers that have been diagnosed, you're put on an antibiotic to kill the H. pylori bacteria. You're on a proton pump inhibitor that blocks the pumps that release hydrochloric acid. And often they'll put you on an antacid as well. So it's useful there. But aloe vera gel also improves protein digestion. So for people as they get older, if they don't digest protein very well, it may be one of the things they can add. So what I'd like you to do to really